is a major weight-bearing joint that supports the body with everyday movements. The hip is a ball and socket joint made up of the pelvis, or hip bone, and femur, or thigh bone. The top of the femur, called the femoral head, and the socket of the pelvis, called the acetabulum, are both lined with articular cartilage. This cartilage reduces friction with movement and helps the bones glide smoothly, allowing the hip to move in a wide range of motion. The hip joint also has a labrum, a C-shaped piece of thicker cartilage that helps stabilize the hip and absorb shock. Damage to the articular cartilage affects the ability of the hip to move smoothly and support movement. This can result in stiffness of the joint as well as pain if the cartilage wears down to the underlying bone and creates bone-on-bone friction. Damage spread out across most of the articular cartilage occurs with osteoarthritis, but cartilage damage that primarily occurs in one location of the joint is called an osteochondral defect, or cartilage defect. Cartilage defect injuries commonly result from a traumatic injury, like a hip fracture or dislocation, but also occur with other hip conditions, like labral tears, hip impingement, hip dysplasia, and avascular necrosis. These conditions reduce stability in the hip joint and can lead to increased pressure or friction within the joint that can damage the articular cartilage. Sometimes cartilage defect injuries can occur with repeated stress that breaks down a portion of the articular cartilage over time. Cartilage defects of the hip can produce a variety of different symptoms, including deep pain within the hip joint, swelling, instability, limited range of motion, difficulty bearing weight through the hip, or walking with a limp, locking, and clicking. There may also be the feeling that there is something stuck inside the hip causing irritation. This is referred to as a loose body, which is a piece of cartilage or bone that has broken off within the joint. A physical examination will include an observation of the patient walking, recreation of the positions that cause symptoms, and testing the range of motion of the hip. To help make a diagnosis, a healthcare provider will likely perform imaging studies. X-rays are used to examine the anatomy and alignment of the hip joint. An MRI with contrast dye can also be used to examine the cartilage. A healthcare provider will use these findings along with a patient's symptoms to recommend the appropriate treatment options.